injuries develop when the skin is not getting enough blood flow. The skin is a remarkably complex organ. It's actually the body's largest organ. It's typically always sending messages to the brain and surveying the surroundings to make sure that the body is safe and to make sure that the skin is intact. When someone has sensation and they shift, that's a signal to the brain that the area that they had pressure on had blood flow constricted, and they're shifting so that blood flow can return to that area. A pressure injury occurs when blood flow is constricted to an area of the skin, and when that happens for a prolonged duration, the skin cells begin to die off, and it can also affect tissue that is underneath the skin. So at baseline, the skin is protecting fat, muscle, and bone that lies beneath the skin. A stage 1 pressure injury affects the topmost layer of skin. A stage 2 pressure injury starts to affect skin structures that are beneath that top layer. Stage 3 pressure injuries begin to affect the subcutaneous fat that is now beneath the skin. And stage 4 pressure injuries, which are generally the deepest pressure injuries, can actually go down into affecting muscle and bone. Many pressure injuries present with redness in the area. Although it may appear that the top layer of skin is just affected, pressure injuries may sometimes be deeper than what can be seen on initial appearances. If you have redness on your skin or you have something that you think might be a pressure injury, it's always a good idea to talk with your healthcare professional or your physician about what's been happening and have somebody take a look.
When I touch the skin, it turns red and doesn't go back to a normal skin color.
So there are many risk factors for pressure injuries. Now, classically, they develop when there's reduced blood flow or pressure on an area of skin that is insensate or has impaired sensation. They can also be due to things like tight clothing, although we typically think of them as happening when people are not moving around as much or when they're in bed for a prolonged period of time. They can also occur from sleeping on things like creased bed sheets. Shear, which can happen when somebody shears a part of their skin, sometimes while transferring, can also be a cause of a pressure injury. Muscle loss can also contribute to putting someone at having an increased risk of having a pressure injury. Things like coming into contact with something that's too hot can increase somebody's risk of an unintentional injury from something like a burn. Any sort of tobacco use or smoking is something that can put someone at increased risk of developing a pressure injury and can also put someone at increased risk of having delayed healing. So there are several ways to prevent pressure injuries. These include performing vigilant weight shifts, offloading pressure from areas that are at risk. If you use a wheelchair, it's important to make sure that you're aware of your pressure points and also that things like your seating cushion and your equipment is up to date and is serving you well. Making sure that you have appropriate padding on things like your shower chair or your commode chair is also important for preventing pressure injuries. It's also important to perform daily skin checks with a mirror and make sure that you're monitoring and that you can see what's happening with the areas that may be at increased risk of developing a pressure injury. It can take time for pressure injuries to heal. While everybody is different, we use a variety of strategies to try to heal pressure injuries. These include using things like an air mattress and performing pressure mapping to determine which areas are bearing the most pressure when someone is either in bed or when they're up in their wheelchair. If a wound is particularly severe, your healthcare professional may recommend that you receive specialized wound care services, either from a nurse or from a specialized clinic. If wounds are slow to heal, surgical options can also be considered.
One of the important aspects after I was injured that was drilled into my head in rehab was taking care of my skin. I'm a T3 paraplegic. I have no feeling from the chest down, no feeling, no movement. I need to be very cautious about my skin integrity and how I manage my skin care. One of the things I do is a pressure relief in the chair. I basically lift myself up about 10-15 seconds. The other thing I have is a cushion that was prescribed to me through a seating clinic, which obviously alleviates pressure and adds comfort while you're in the chair. If I'm sitting on the floor or a hard surface, this is just a garden cushion, and it helps obviously add cushion to any hard surface you're sitting on. You don't want to sit on this for a long extended period of time, but it's good if you're moving around or you have to sit on a hard surface. anywhere you go. The other thing that I have, which I've had for 24 years actually, is a mirror. It has an extension on it, so it allows you to inspect your skin. There are obviously parts of your skin you can't see. I mainly use it while I'm in bed to inspect my skin. So another thing I do when I'm in bed, sleeping, I put a pillow between my legs, and that prevents any, again, skin-on-skin contact with pressure. And I typically put a pillow. I'll have two pillows. I've used a pillow to sleep on, smaller pillows behind my back. I typically sleep like this on my side so that my back's got support. The only pressure is going down on my hips, but you also have to be careful of your hips when you're sleeping. But generally this is how I sleep. I sleep on a regular mattress. There are different types of mattresses you can buy. There are actually things called air mattresses that people sleep on. Again, everyone's different. This is what works for me, but people should figure out what may work for them, and again, talk to their physician about what may work best for them.
Good, you already have your lunch. Nutrition is an important part of the rehab process, especially when it comes to skin health. If you already have a pressure injury present, more specific nutrition recommendations are needed. The #1 goal for healing is enough calories to prevent breakdown of muscle. Strategies to increase calorie intake include eating snacks between meals, adding extra dresses or sauces, even adding extra butter or oil, choosing higher fat items such as whole milk instead of skim milk, and drinking high-calorie protein drinks. While weight can usually tell you if you're eating enough calories, wound healing when pressure injuries are present is actually more telling. Once you're sure you're eating enough calories, the focus transitions to making sure that you're eating enough protein. Protein is the main macronutrient for healing, and the body can only absorb so much protein at one time. It's more beneficial to have a serving of protein with meals and snacks rather than eating a lot all at once, because any excess protein will actually be burned as energy or stored as fat. People with higher level spinal cord injuries may have trouble feeding themselves and meeting their calorie and protein needs, so in those cases it may be helpful to include high-calorie protein drinks or even milk throughout the day. Supplements like these can also help to meet fluid goals, since hydration is critical for skin health. Decreased skin turgor and dry skin are signs of inadequate fluid intake, but the best indicator is actually urine color, with light yellow to almost clear being the ultimate goal.
Recently I was diagnosed with a pressure sore. My PCA actually found it when she was doing the skin check. Doctor has me doing is staying in bed 22 hours a day, only getting up for 2 hours to give a little relief from that. Now what I do for the pressure relief, I have this little thing on the joystick that helps me go up and down to change the position. So what that does is it takes the particular pressure off the sore, puts it in a different perspective. Because I am a quadriplegic, I have no feeling from the breastbone down. I didn't have any symptoms like a fever or extra spasms or anything like that. What happens is you develop a red spot. You think it's just a little red spot, but it could be, the wound can be underneath the red spot. And then once that opens, it could be deep, it could be tunneling different ways. So you just never know what's going to happen until the doctor actually looks at it. To heal the wound, what I'm doing is it's recommended that I eat more protein, because protein promotes the healing. So I have to eat a lot of chicken and fish, and I was doing protein drinks and also protein bars. I eat a lot of yogurt. I have a yogurt every day. And I drink a lot of milk now. I do have a wound care nurse that comes off. She measures to see the depth of the wound and the width of the wound. I do have a hospital bed, and on top of the hospital mattress, I have what's called an alternating air pressure mattress that goes over the mattress. What that does is it has all these bubbles on it, and like lines of bubbles. What that does is it's constantly putting less pressure on the wound. Now, they do put pillows under me to change my position in the bed so that every 2 hours they can turn me. So without that, you're just constantly putting pressure on the wound, just like being in the chair. I rely on the PCAs to check my skin to make sure that I'm not developing a pressure wound, because you can get them pretty much anywhere. Where I can't check myself, I have to rely on them to check it for me. I'm gonna have to try and stay out of my chair some hours in the day for a while to build up a tolerance. I'm gonna have to eat more protein still, you know, stay on that diet and make sure that the PCAs really check me well. And as soon as it starts getting red, when we see anything, we have to get off of it for so many hours a day. I'll just have to be tolerant and make sure that I don't go out as much as I do.
Thank you for watching this video on skincare for people with spinal cord injury. I would emphasize that everyone is different. So just like everyone is different, every pressure injury is unique and requires a unique treatment plan to help improve it. It's important for anyone with a spinal cord injury to be vigilant and try to prevent pressure injuries, but it also isn't just the work of one person to heal a pressure injury. It involves a team, including caregivers that may be with someone at home, as well as healthcare professionals. So if you feel you're at risk for a pressure injury or you develop a pressure injury, it's important to begin working with your team of caregivers and healthcare professionals early and often.
Thank you for watching this module from the Spinal Cord Injury Toolkit series. We hope that it's been helpful to you as you expand your knowledge around spinal cord injury and health. For additional information and resources, please see the Spinal Cord Injury Toolkit section of our website listed here. We also welcome your questions or comments on our YouTube channel or social media. Thanks again and have a great day.